October meeting. As you can just unmute and make that motion.
So moved.
Thank you. A second, please.
A second, Glenn Harrington.
Thank you, Glenn. Anyone have questions, concerns, observations, corrections to these minutes? If not, all in favor, please indicate by saying aye.
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 Thank you. Any opposed? The October meeting minutes are approved. Amber, I'll get back to the list of, yeah, you can take the members. I'll be monitoring the participant feature to catch folks who want to contribute.
And I'm sorry, I added this slide just last minute just to make everyone aware, since we haven't met in the last 2 months of the previous year. Just wanted to give you guys a more updated list of the 2025 SBPAC members. Rick and Amber are co-chairs, and everyone we had in the past are still here, with the exception of one business owner who is no longer able to participate. And we've had some updates to some members that were representing some organizations, but for the most part, these are names and folks that you recognize on this list. So just wanted to provide this quick updated list. And then, I'm sorry, Amber, I was just going to introduce Dawn from our team. Dawn Fairburn, if you'd like to just give yourself a quick introduction, and then she'll also provide us a demo of this enrollment portal that we've been building for the past 1.5 years or so.
Hi, my name is Dawn Fairburn. I'm the requirements manager here at MHBE, and I'll be going through the employer and employee portals on the new shop platform. So let me share my screen and I can get started if you like. And can everybody see the screen?
Yes.
Okay. All right. So this is the new shop portal. It's still in development, so not all functionalities are working, but we definitely have the employer and the employee portals up. So for employers, when they want to get started and create an account, they would come here. This is the main website page. Anybody can get a quote. Or if they want to, like I said, get started and create an account and see if they're eligible for shop, they can come here, click get started. And this is the create account page. So they just have to enter in a little bit of information, their first and last name, and then an email address. And then they'll create a user ID and a password. And we do give them a little help on what the password, it needs to be 9 to 15 characters, one number, an uppercase, lowercase, and a special character. And as they go through and they tick off these things, these all will turn green. If any of them are left red, then that means they haven't met the password criteria. So click the create account. Tells them congratulations, and then they can go ahead and log in. And then it brings them directly to the register business screen. So here, you know, it's quite a bit of information to enter. So bear with me, but I will try to be as quick as possible. Ask their organization type. Date established. And I'll just say January 1st, 2024. And then it'll want to know who's the primary contact and the CEO. In this case, it's going to be the same person. Did somebody have a question?
Yeah, I see Eugene's hand is up, and while you're filling out the form, we'll try to see.
Yeah, the SIC code. You're not going to have like a drop down because often they don't know the SIC code or the NAICS code. So in both those situations, you may want to have a sort of a drop down or something that they can choose from.
A drop down of
I
like
agree.
all
I don't-
available.
Available
Nice.
SIC codes, yeah. We commonly see that when we're doing quotes, when we did Benefit Mall and others, they have you can just search right then and there based on what you do for a business. And it just brings you right to the tables, and it says based on what you do, doesn't choose this code, and that code just pops right in. Same thing
I
with
agree. I
NAICS
just
code.
made a note also to ask that as well, Eugene.
Great minds think alike, I guess.
Well, yeah, thanks for that suggestion. We did not implement that on this feature in the initial launch, but I think we can make that a future enhancement for sure. But that's a good suggestion.
All right, any other questions on this screen before I move to the next one? All right. Then they put in, we do have a search feature for their address, or if they just know it, they can just type it in.
Quick question again. On
Sure.
that business, on the business address, it says it must match what you have on the employer identification number. What if they've moved?
So this is all self-attestation. It's not like we're kicking the group back if it doesn't match, but preferably, we would prefer that it matches when we send it to the carrier so they don't have any issues with implementation at the carrier level.
Okay.
And then we have a checkbox for the mailing address. If it's the same, they can just click that. They don't have to re-enter. If it's different, then they wouldn't check the box, and then they would enter whatever their different mailing address happens to be. We have this checkbox for other locations that they can fill out. I'm not going to do that in the interest of time. And then we also have these 3 questions that we default to no, but they can update to yes if that applies to them. Any questions on this screen? All right. And then we ask about their primary health plan, if that's going to be primary or Medicare, and Medicare be secondary. Do they have an insurance broker? And if they don't have an insurance broker, then we can help them find one. So if they want to, and they want to click yes to find one, we'll take them to this page where they can search or, select whoever they want. And in this instance, I'm just not going to go through that right now.
Can I
Any
make a
questions?
suggestion? Yeah, can I make a suggestion on the Medicare primary or secondary? A lot of groups aren't going to know that either. So I think it would be helpful so that it doesn't stop them at that point and they have to call.
So it won't stop them. We default to no. So they can
Okay.
leave it as no, or it's just a yes, no question. That's it. there's no additional information needed.
Yeah, and if they don't know and if they decide to skip that question, it doesn't stop them like Dawn just said. Basically, they can still move on to the next step.
Okay, and it won't affect them at the carrier level if they leave it defaulted as no.
No, it's not.
Okay. Okay.
All right. And then they get this review screen when they're complete. So they can review all the information that they entered in, and then they can sign it. And then click register. And then once they've registered, they have two options. They can just go to their dashboard, or if they want to click this to see if they actually qualify for small business. So, we just have these 4 basic questions that they need to answer. Yes, they 1 to 50. I'm in Maryland. I'm going to provide to all full-time employees. And yes, at least one is not an owner or business partner or spouse. We also offer these informational little tips, helps that you can hover over and get a little bit of additional information for each of the questions.
And I was gonna say that they have to answer yes to all these questions. This is already on our current portal. Actually, the eligibility determination feature is that currently exists on our platform. But just to let you know, so if they answer no to any of these 4 questions, they will receive a denial of eligibility. Then they can't enroll.
And then we offer this little disclaimer to say that you have to complete enrollment and coverage and have at least 60% of your employees enrolling in order to meet the minimum participation requirement. All right, then now we'll go to the dashboard. So they're registered, they're eligible for SHOP, and then this is their dashboard. It gives them their business name. If they had a broker, it would show that here. And again, they can find a broker if they choose to select one. And they can also do it down here as well. So there's like two areas that they could select a broker. Then the next step for them would be to add their employees, whoever's in their roster, so that way they can start their benefit package and start enrolling in coverage. So let me add employees. So they'll click this, add employee. I guess one other thing, they also have this nav bar here where they can click, on these to go to things quickly if they don't want to go from the dashboard. So like this shows their messages, any messages that they received, employee notices, things like that. They can go to their quotes, and they can also go to their profile. And this is where they can update their phone number, their email, if they want to enable multi-factor authentication, and if they want to receive paper notices instead of going paperless. So we default everyone to paperless because we're trying to save money and cut costs, but they can change to here to paper if need be. They also have their password change is under the My Profile. And this is where they can add administrators, which would be, their employees that they want to add as administrators for their company. Do that here. So let me go to employees and add an employee. And there's 2 options. You can manually enter all of the employee information, or you can upload a spreadsheet. And if they choose the upload spreadsheet, we do have the template for them, which they can click on this and download the template and then fill it out and then come back here and upload. So let me click on upload. and I'll select the roster. And then it uploads it into the portal for them with the information that was added in the spreadsheet. And then we'll confirm it. So we now have 3 employees uploaded into the portal for this particular company. Once the employer has added their employees, they can then go ahead and start their benefit package. So let me do that. They have to create a name. I'll just say OE 2025. And then we give them 3 options. They can choose the earliest, a middle, or the latest they can choose is, the 5/1 date. So we'll go with 3/1. And when they make that selection, we will automatically default their open enrollment dates. And we give them a little note here, like your open enrollment period may begin on the 29th, but it must end by the 10th. And then they can select who they are going to offer coverage to: full-time employees, part-time employees, if they have contractors. Do they want if these people have any dependents, do they want the children's coverage to end at the month they turn 26 or at the end of the year in which they turn 26? So they have those options. They can set a waiting period for existing employees. And also for newly hired employees, they have 3 different options of when coverage should begin for them. And the same for rehiring employees. When should coverage begin for them? So any questions on this first page of selecting the benefit package? All right.
I did, Dawn, I'm sorry.
That's
I do
okay.
have a question, actually 2 questions. Going back a couple screens when they are in the approval screen, will their formal letter be housed there? Like they receive a letter with like a registration number. Will that be housed?
The letter that they get will be in their inbox.
Okay. And then on this one, so when we're with this platform creation, will this go, we've talked in the past, will it go directly to the carrier, or we as brokers still fill out the carrier contracting that they require in addition to the shop contract form?
Can you repeat that? Wait, what were you
Yeah, so right now, if they select the employee choice, we just submit the group app to the carrier, but then there also are other contracts that go along with it. Will this automatically be transmitted to the carrier, or will we as brokers still have to fill out the contracting and submit?
No, there shouldn't be any other forms required once we launch this portal.
Okay.
This would be the only requirement basically. And Dawn is just going to go over exactly how they would choose an employee choice, or these are the coverage models.
Okay.
Yeah.
Gene, you had a question?
Yeah. What about the consent form? The consent for the broker to work with the client. Can this be built so the consent form is already in there, so we don't have to worry about that? When we start the process, the consent form, they agreed to have this broker, and they give that broker not only selecting the broker, but they're giving the broker permission to shop on their behalf.
Like a business associates agreement.
So we don't require a specific, it's just the Tango process, same as the individual platform. So as long as the employer has tangoed with you, and that where they select you as the broker and you show up as the broker of record in the system, that's what we're transmitting to the carrier. And that's exactly, you would be, that is the attestation basically.
Good.
All right.
And then probably if we do have additional business associates agreement, Eugene, if that's what you are referring to, I
Yeah.
think we could still probably be at liberty to have them sign that, and that will protect us from that side.
Right.
Mimi, what do you think about that? Are you familiar with the business associates agreements that we generally have with groups?
Yes, yes, I am familiar with that, and that's optional, right? So, yeah, absolutely, you can continue to do that if that's what you choose to do.
Okay, thank you.
Glenn,
So I have a question about the tango process. Sometimes when the tango in the individual market, it sometimes, if they don't have their pop-up lockers off or a trusted site, it appears that they're selecting the broker, but it really doesn't select the broker. Is this system going to be more streamlined where when they select the broker, it actually does tango it so that I don't have to go? Because it's sometimes I've spent 15 to 20 minutes just, getting the Maryland Health Connection producer hotline to do a forced tango, because after trying to help them, turn off their pop-up blocker and all that and, select the broker. Is it going to be an easier method there?
As I don't think that we've looked into that. I don't know if Dawn, you can provide a better answer, or if that's something we'd have to look into and get back to them.
Yeah, I honestly, I don't know if there's any changes made or if it's going to work the same way that it works on the individual side.
I mean, I'm sure I'm not the only broker that has this problem, correct? That's on the call.
Correct.
Absolutely.
So I think that should be a kind of a priority, because we spend a lot of time, in my opinion, we waste a lot of time doing things that we shouldn't have to spend time with the consumer.
Yeah, so this is the first I'm hearing of the pop-up blocker by users preventing them from conducting the Tango process. What I can do is just take that back to IT and see if that's something that we can look into.
My suggestion would be to put like a little note at the top when they go to select one. Please make sure your pop-up blocker's off, or it's a trusted site for this to actually work.
Gotcha.
And I have a suggestion or a question as well. Is there a way to eliminate multiple applications on the individual exchange? I know that we experienced that a lot this year. People can have, 6, 8 applications, and that causes a problem with the Tango process.
So we can't speak to the individual marketplace in this call, just because this is just the small group market. This call is just specifically for the small group market. But I do see that Rita has her hand up to address some of the broker related questions. Rita, go ahead.
Yep, I was just going to say, with regards to the broker portal pop-up, I don't see that there's a pop-up in the procedure. So I'll definitely take that back as an action item. The way that it's designed from the flow that I'm looking at is that it goes screen to screen, but that there's not a pop-up. So we'll take that back to do some testing. With regards to multiple accounts, there's really not a lot we can do with consumer behavior, right? We tell the consumer assistance workers, brokers, and everyone else, best practices to the extent that you can probe and find out if there is already an account in existence. And if so, the consumer can contact the call center for assistance accessing the account. They can also go right through Flora, which is the chat bot, which should be quicker and easier so that they can get their credentials. We know that it's, besides the fact that there's a problem with the Tango if they have multiple accounts, there's also a problem with the enrollment if they have multiple accounts. So we want to make sure, as much as possible, that all of our consumer assistance workers are doing due diligence to log in to the same account that the consumer already has and not create new accounts. In terms of, archiving and things like that, there are compliance regulations regarding that. So, we can't eliminate the duplicate accounts. They're there.
Well, I basically meant, like, on this platform, is there a fail safe we can maybe put in place so that doesn't create the same problem as the individual market, like to where they can only create one account. So once they put in their tax ID, like that's them. You don't have, they wouldn't have the opportunity to create multiple accounts, was what I
Okay.
was thinking.
I apologize, Amber. I misunderstood your question then. Okay, yes, if it is about this platform then, and Dawn, could you, do you know if we allow duplicate EINs to be created on this platform?
I don't believe so, Mimi. I mean, I think when they're creating their account, we're using their name and email address right now. But I think for the EIN, if they've, I don't think we allow separate accounts, but I don't know. We'll have to go back and check.
Yeah, yeah, you're right. In the current platform, we won't allow them to use the same email address, but if they use a different email address to create essentially the same account, like the EIN business name and everything, that's something we'll have to look at, Amber, but that's a good point for us to look into.
Okay, so for the benefit package model, there's the three options. They can have a single plan, which is one plan from one insurance company, or they can have the all plans from one insurance company, or multiple plans from multiple insurance companies. And this one's based on the metal levels that are chosen by the employer. So if we do like all plans from one insurance company, we can then select which insurance company we want, whether it's CareFirst, Kaiser, Aetna, or UHC. And then we have to choose a reference plan. And then once we get to the reference plan, they can determine how much the employer wants to contribute for the monthly premium. And then set the contribution amounts for each of the categories for the full-time employees, along with their spouses and children, and the part-time employees. So they can go up or down, whatever, they want to provide for each of the options. Then we also list out all of the plans here, and then the employer can, go through and decide which plan they want to actually choose.
Yeah, and just to add here, on the left-hand side, the employer's contribution for full-time, spouse, dependents, and part-time employees, and their dependents and spouse are on the left-hand side by percentage. And then this would be the selection of that reference plan under the coverage model. Amber, go ahead.
Thank you. So if they select multiple plan options, I know that we discussed potentially putting in place kind of similar to what Benefit Mall has, to where they can pay a percentage of the base plan. So if they select 3 plans with one carrier, it's common that the employers will want to pay a percentage of just the base plan, and then the employees can buy up to any additional options. Is that possible to do here?
Yes, yeah. So that base plan would just be what we're calling the reference plan. So yes, they can do that. They can select multiple plans. Can you just navigate to the previous screen really quickly, Dawn, if this if it lets you do so? I just want to see the coverage model types. There. So it wouldn't be where they select like 4 plans and add 1 plan as the base plan. It would just be, it would be all plans from one insurance company, or it would be from like the employee choice, which is the multiple plans from all insurance companies, and just based on the metal tier, and then a single plan. So it wouldn't allow you to select just 4 plans, for example.
Any other questions on this screen before I proceed?
Go ahead, Glenn.
So just to clarify that, because I was, I was in the car trying to multitask and listen. Did I understand that correctly? That if they pick one carrier, they can actually have the whole options of plans? Is that what I heard? That they could select from like a bronze, silver, gold, platinum,
Yep. Yep.
any
So
plan out of all the plans that are available?
it's not all the plans. It's basically under employer choice. It would be all plans from one insurance company, from one
So if
carrier.
they have, let's just say they have 40 plans, that employee could
Mhm.
pick from 40 plans.
Right. But we don't really have any carriers with 40 plans available. But yeah, all plans from one carrier would be available.
I would think United would have, when you add the Navigate, the Essential, the OCI, the Choice Plus.
Yeah,
They
there's
probably do.
definitely a lot. Yeah, there's like 20 or more, I think. But yeah, definitely there's but they would select their reference plan, so that should kind of help the employee see this is the base plan, and as they go up in the value, then their share is gonna increase, and as they go down towards like the bronze plans, then the premium would decrease. So it's the benchmark plan would, and that's really where the brokers would come into play here too.
Well, here's another thing then. If some employers pay 100% of the individual rate for the base plan. So you run into somebody like that, it would confuse things if the system didn't have the default plan. Let's say it's a silver plan. None of the bronze plans should even show. You know what I
If
mean? Because why would they buy down if the employer is going to pay 100% of the individual premium?
that's true. I mean, but let's say they're also adding their dependents to that
That's a
plan,
good point.
right? So they might say, hey, I know I'm getting 100% of the silver plan, but my family is not. So I might want to buy down to be able to make up for the cost.
Good point.
Yeah. All right, Dawn, back to you.
All right. So let me quickly choose a reference plan. And I'm just going to grab one here. It doesn't really matter, I don't think. So we select the plan, move on to the next screen. We get the final confirmation. So it'll show the total cost per month, total employees cost per month, and the employer cost per month. And then they gives the payment deadlines, blah, blah, blah. Then we get the confirmation screen, and we have a bunch of check boxes for them to read and agree to. I'm not going to read all of these or we'll never get through. And then they sign. And they can sign their name. I'll just put a squiggle there, confirm. And then they're done. They've created their benefit package. At the point that they create their benefit package, the system will then send out emails to each of the employees to go ahead and create an account. So let me go here. Let's see, this was the first one to Morgan, so that just saying, hey, you created your account.
Hey, Dawn, one quick question, or not a question, but a clarification. I did get information that the system does a check against EIN. So to answer your question, Amber, or was it Eugene who asked the question about duplicate accounts? That would not happen, because if the same EIN was used to create another account, the system would throw that back, or an error message would be thrown to prevent the employer from recreating another account.
Great, thank you.
Sorry, I was just checking to make sure I had the right email addresses on there. Okay.
Yes, Amber?
Thank you. And also, to what Glenn was saying, I think that he wanted clarification as well. I believe that we're still only offering up to 4 plans, correct? Or 3 plans. Say if you choose one carrier, you can select up to 3 or 4 or 2 to 3 plans, correct? We're not saying that an employer can have 9 plans in place, correct?
No, it's not so much about how many plans the employer is having. It's basically if you have seen DC's model, DC's system, they allow you to select just one carrier, and all the plans under that carrier would be available to the employees. So it depends on how, like, let's say you have 10 employees and they all pick a different plan with Care First, 10 different plans, then yes, the employer has 10 different plans with Care First.
Wow.
But
Yeah, I want to interject though. The Blue Cross Blue Shield only allows 3 plans in small group.
Right.
Okay. And United Healthcare only allows 2 for these small
Correct.
groups. So I don't know where you would get an advantage to the private sector versus the Maryland Health Benefit Exchange, because that would change things. When you said that, it got me thinking. I'm like, well, that's an advantage that the other TPAs and if you go direct do not have. I don't know if you knew that or not.
And that's confirmed that they can have as many plans as they want.
right, and it's not so much that we're allowing the employer to select those number of plans. And I think when you do a paper application, it does pigeonhole you to, selecting the number of plans that you want to offer. But our system allows you to select the carrier, and the employees enroll in the plan that they want.
Well, that's unfair business practices, in my opinion. Because let's say if somebody didn't get the federal tax credits, right, and they choose that they want to have one carrier, then the private sector, if they wanted to do that option versus the Maryland Health Benefit Exchange shop market, it's not the same equivalent playing field. So did you say that has Care First given and United Healthcare given that authorization with because it's their rules that they follow, and we as brokers have to follow those rules.
Right. To this day, we have not received any feedback, prohibiting us from doing that. But but Care First is on the call, and if they would like to, and here's Brandon also stating that the same thing that I just stated, that DC allows as many plans as they want. And we were just following the DC model
Right,
as
but
well. So I don't think we were doing anything, that was unfair to others in the marketplace.
Well, I'm just saying that some of the TPAs, if they're aware of this, they're going to think that it's an unfair business practice. So I don't know if the carriers are on the call, but is that going to open up the opportunity for people that would choose to use a TPA as opposed to the Maryland Health Benefit Exchange? How are they going to address that? Because I'm sure this is the first time I've heard of this, and I guess Amber, first time she's heard of it. And we're brokers on the call. We know what the rules of engagement are in Maryland small group. We're not talking about DC. We're talking about Maryland small group.
But we're talking about the exchanges overall, overarchingly. That's one of the benefits of choosing to go in the exchange. So in the grand scheme of things, this will give Maryland Exchange a one-up by being able to offer multiple plans and not being tied into a 3-plan number.
And what carrier is this? I can't recognize who's speaking.
This is Brandon from Kaiser, but I'm just talking about overarchingly. If our goal is to increase membership on Maryland Exchange, it seems like it would be a great idea to offer more than 3 plans.
Well, that's understood, and I'm sure every broker on the call would agree with that. But when you have, a small group of, let's say, 5 employees or 10 employees or what have you, to have that many plans, the carriers currently as the exists in the private market space with the TPAs, and either if you go direct, those are the rules. So are you saying that the DC exchange obviously is set up that way, and that's fine, but is there a ruling of the exchanges in some kind of regulation that states that that can be done, or is this just something that Care First, United, and obviously Kaiser has spoken up on this? I don't know if Care First or United's on the call, but it'd be nice to
They
know.
are, Glenn. And I really don't want to use this platform at this moment and in the interest of time to address that.
Okay.
And I would say there is nothing in the regulations that prohibit us from doing this. If the carriers are not allowing TPAs to do that, the TPAs can take that up with the carriers
Got
offline,
it.
but
Okay.
this wouldn't be the forum for that. But in the interest of time, let's let Dawn continue the presentation and that demo.
Okay. Well, thank you for allowing me to talk about it.
Okay, so the employees will receive an email to create an account. And the only thing is, I think there's a batch job that has not run. I can show you a previous one. That's it. Yeah. So, it gives the employee this emails to inform you that your employer has added you, and to start enrolling it gives a link for them to go ahead and create an account. I'm just going to click this right now just to show you that process while we're hopefully with the batch job will run for the cases that I'm actually working on. So the employee will get this create account screen. You can see it has their information pre-filled for them. They just have to re-enter their email address and create a user ID. And again, they have to create a password as well. Oh, I think I hit the wrong key. Then they can accept and create their account. Oh. Okay, they'll get the congratulations and they can go ahead and log into their account. And they'll ask to verify their email. And then it asks them if they want to register a cell number. I'm just going to say no at this point. And if they want to remember this device. And then it brings them to the My Details page where they can confirm that their information is correct, that their home address is correct, and they can add a phone number.
Go ahead, Glenn.
I have a question about the products that are being presented on the site. The point that I was making about the Navigate, the Essential, the OCI, Choice Plus with United Healthcare. Is there, when they're looking at these plans, because I've had a few people call me and say, hey, the rates are less expensive on the shop plan. And some of the plans they may have been looking at were like Navigate plans or Essential plans or OCI plans. Is there a way for people to kind of, because it's a metal plan, like if it's a bronze, it's a bronze. If it's a silver, it's a silver. Deductibles look the same. copays look the same, but is there some way that these carriers or there's something to explain the network in that definition so they know if they're buying a plan that, I mean, I know that's our job as the broker. I'm just, when they're selecting and picking plans and then a broker is either assigned to it, we need to explain that to them, but they may think that they're getting a better deal when they find out that really it limits some of the doctors and hospitals that they may be using.
Yeah, that's a good point, Glenn. And when we get to the employee shopping, you can see like what all the information that's included in the plan shopping in that tile and the network and everything and how it's being portrayed. I know on the individual platform, we do have like a search feature for like finding a doctor and seeing if the doctor's in network, just to make sure that they're buying a plan at least that includes their doctor. Um, and as far as like the explanation for the network and all of that, there are tools on the plan display that show the plan offerings and like the value proposition from the carriers. And we can look at that when we get to the employees plan shopping.
Okay, great. Thanks.
Okay, so once the employee verifies their details, we bring them right to family composition where they can add dependents if they need to. So if they wanted to, they could add their name, gender, date of birth, their relationship if they're looking for coverage, blah, blah, blah. If not, they can just continue on and then they'll get their dashboard. And here they can either waive coverage or they can go ahead and start enrollment. So let's say they want to waive their coverage, they will get these options for waiving. They can waive due to other coverage through another person's job. Maybe they already have private health plan through the federal marketplace or the individual marketplace. They might be waiving because they have Medicaid or TRICARE, or they might waive because they don't want health coverage through their employer or other. And if they select other, they can specify. So we'll just say that they're waiving because they have coverage through another person's. It'll let them know that they've successfully been waived. And then when they go back to their enrollment, their dashboard, they're pretty much done. If they change their mind and they don't want to waive coverage and they really want to enroll, they can still enroll. They have the start enrollment button. So if they click there, they'll see the reference plan that the employer chose. And then they will also see all of the other plans that are available for them to choose. And it shows how much the employer is going to contribute and what their premium amount will be based on the plan that they select.
Hey, Dawn, does the details button work on this right now, or is that not developed yet?
So when you click details, it'll give them this, that they can scroll through. Any particular section you want to go to, or you just wanted to show?
What I wanted to show was in our current portal, like we have the plan display that shows like wellness information from carriers, the value. I'm going to try to pull that up and share it for Glenn because he had some questions about like how they choose a plan based on the network and exactly which network they're buying into when they select a certain carrier.
All right. So they can just select, and then it'll give them a confirmation screen, show them all the details, and we'll click confirm. And then it lets them know they have been enrolled and their coverage will start.
Amber has a question.
Thanks. So here, is there a way to add per pay versus monthly cost? You can either, maybe we can do weekly or bi-weekly, which would show that amount versus monthly, because most employees, of course, aren't going to pay monthly. This could be, I feel like it could be really confusing. Can we just add a tab that says like, what is your pay cycle, weekly or bi-weekly, and then have these numbers reflect the bi-weekly or weekly?
Yeah, that could be a future enhancement. We'll take that back.
I mean, this would be good for the employer side, but for the employee, when they're selecting the plan, they're going to want to know what the per pay deduction will be.
Yeah, and that's really also done through payroll anyway. And I think that it might look different because payroll could be, monthly or bi-monthly, or it would look different, right? Depending on where it lands. So, but it's still a good suggestion. I think we could pull something like that off in the future.
Okay, thank you.
All right. And then also in the employee portal, they have the option to report a change if they need to add dependents or change their address or anything. They can do that. If they get married and they want to add the spouse, they can report a change, select an SEP so that they can add their spouse onto their coverage. They can also disenroll their coverage if they choose, if they no longer want to participate. Maybe they did get married and they're now on their spouse's plan, and they want to disenroll their coverage from here. They can do that.
Gene?
Yeah, quick question. What happens if an employee has set up the account, then they go to work for another employer in the state of Maryland? What happens to their employee account here? Do they have to create a new employee account, or do they take the current information they have them? And are they independent as employees in the Maryland Health Connection system that would allow them to carry that same information from one employer to the next employer, or must they do a complete new application?
They can keep their existing, if they move to another shop employer, they
Mhm.
can keep their existing account. And once their new employer sends out or adds them to their roster, then they can enroll in coverage with that employer. But they would have to first disenroll from coverage from
The current employer.
a current employer, correct?
But if they may have a runover period where they are applying in both situations so that they don't have a break in coverage, there might be some overlap as far as them when this program ends from the previous employer to the new employer. I just want to make sure it doesn't cause a problem within the system. It says, hey, you're already existing with this other company. Yeah, but my program hadn't ended to the end of the month. I'm going to this new one starting the first of the month, but I won't disenroll necessarily until I know I have the effective date on the new company, and I'm beyond their waiting period, what have you. Just a thought.
Yeah. Yeah, that's a good question. I think that our system, as long as they're being transferred, as long as it's groups within on the exchange or on MHC for small business, I think that was taken into account that the previous plan would not interfere with the new plan that the employee is enrolling in.
Mhm. Okay.
Glenn, you had a question?
Along that same line of what Eugene was saying, what about if they decide to take Maryland continuation as they qualify? Are the qualifiers set up of what the requirements are? And then if they do qualify, how is the Maryland continuation administered?
Yeah, right now the portal is being designed to account for COBRA enrollments for the employee only. Spouses and dependents would have to be done off the exchange, but meaning they are still, enrollment could still be happening through our portal, but their election would happen at the employer level. They would notify the employer would come back into the system and activate the COBRA for the dependents if that's what they choose to do, if they want to enroll in COBRA. But aside from that, the employee could opt in for COBRA, and that is a functionality that's still in development. But that is something that we plan to go forward with.
Thank you.
And for the plan tile display, Glenn, if you don't mind, I know you have an account through our portal. If you don't mind just logging in and just looking at the plan displays for any of your groups really, and just, just so that you can see exactly what information it's going to appear the same way. We just don't have it right now for you to see. These plan tiles are just placeholders right now, but they're going to be updated with what you see right now in the system. So it's going to have the wellness resources for employees, and it's going to have a prescription drug surge, plan cost and benefits, important plan information about the value and the network of that carrier. The carriers provided us this information to upload into, it's like brochures that we've added links to in that plan display for each plan. Eugene, do you have your hand up?
Yes, yes. The other thing I run into is a lot of employees, primary persons who are now age into Medicare. And their parents, their wives, spouses, dependents are still on the company plan. But what happens often is that when a person ages into Medicare, they kind of come off the company plan. And if the group is under 20 employees subject to ERISA, as we all know, that they must take Medicare A and B because Medicare is going to be primary. But the problem is that the carrier is looking at it and going, "Hey, wait a minute, you aged out." So how does the system accommodate that so that people don't all of a sudden lose coverage because the primary person now has aged out into Medicare?
That's a good question that was accounted for. That is a federal COBRA rule where the dependents and spouse would be eligible for COBRA if the employee was to enter into Medicare. And so, yes, we have that ability to allow the employee to go off to the Medicare plan, but allow the employee and spouse to remain in the coverage under the employer.
Amber has a question.
Yeah, I just wanted to suggest, I know that there are a lot of the details, and us, myself included, Glenn, Eugene, all of us, we hate to take up time, everyone's time. Is there an opportunity for us to have like a little think tank for us to really give specific questions and suggestions to what we know would work, the things that we can see and make suggestions in that think tank, and then kind of bring them into these committees? Because I know that we all feel bad taking up the time, but they are super important issues that we're bringing up.
Yeah, absolutely. I think that's a great idea. We can set up something separate from this meeting to take your feedback. If you have anything in writing that if you want to send it ahead of time so that we have time to look into it first, that would be great. But we can set something up separately from this meeting.
Okay, great. Thanks.
So is
All right.
there anything else, Mimi, that you want
Yeah,
to
I
show?
wanted you to share this just so that Glenn could see. This is the plan tile display that would normally appear for employees and the employer. So you can see all the tabs at the top. And I was just suggesting that you could log in and just click on those tabs and see what each item represents, or what links open up for each item. Yeah, Glenn.
The individual market has similar things, but I'm not sure if United's on the call. They could have a separate tab, and I don't know if it'd have to be in development or if our brokers, we as brokers need to educate, but there's definitely a defined difference between the essential, the navigate, and the OCI and the choice products. So I haven't seen, because there isn't an individual navigate essential plan or OCI plan on the individual marketplace. So their plans definitely differentiate skinnier network and reduce the cost because of it. So
Mm.
it would be helpful, at least if the consumer knew a little bit about that and how United actually has separate networks, and however they can do that would be helpful, I think, to the employer upfront, so that when the broker then says, "Oh, I'm sorry, you picked a plan," just so you're aware of it. You got a smaller network. Premiums are great, but just keep that in mind. You know what I mean?
Yeah, and I can bring that up to the independent, our separate calls with UHC regarding that. I don't see them on the call here today, but we can definitely bring that up to them at our separate meeting. And just so that, because we're at 2 o'clock and we only scheduled 30 minutes for Dawn's demonstration, and I know we didn't get through a lot, but we could just give 5 more minutes for Dawn to wrap up, and then we have to move on to other agenda items.
Right. Okay. Yeah, okay. So this one, the employees start enrolling, it'll show you how many employees, how many have enrolled, how many are not enrolled, and how many are waived. And then it will calculate the minimum participation rate, but that does happen through a batch job at night. And so that's not running right here, right now. So I'm not able to show you like the updated MPR for the group. So here's the employee notices that actually go out in the inbox. So the employer can actually click on these to see which each of their employees, what notices they received, the information that's provided in there if they need to. And I'm not sure what else. I think that was everything. Mimi, is there anything else you want to show them?
No, I think this has been very good. But I would like to hear, I know we have a couple of employers in this group. If you all have any comments, we'd like to hear your opinion as well. All right. So, and we'll take, you guys can email me directly if you have any other questions or comments about this as you process everything that you just saw today. But thank you, Dawn. I appreciate your time. I know this went a little bit more than what we expected time-wise.
And sure, no problem. Have a good afternoon, everyone.
Thank you, Dawn.
Yeah.
Thank you, Dawn.
All right. So our next topic here is the discussion around affordability for small group plans. And that's become very increasingly important. And so I just put together a couple of slides to kind of help the discussion move along. So these are the most recent rate filings from each carrier in the small group market in Maryland. For instance, this year, a 40-year-old residing in Baltimore in the Baltimore area is seeing rate changes for the lowest cost silver plan, off exchange silver plan ranging from a minimum of 0.1% to 14.6%. And on average, the monthly differences vary from $0 to $51. And so currently the average cost of the lowest cost silver plan stands at $440. Similarly, the lowest cost gold plan for a 40-year-old residing in Baltimore is $513 per month. And if, say for instance, this employee has a spouse and he's going to enroll his spouse, that rate would likely double to about $1,000. And if you add 2 children to that, that could easily reach up to $2,000. Or close to 2,000, maybe 1,500. But if the employer offers about 50% towards the employee only cost, which is what most companies offer nowadays, the employer, and in Maryland, they're not required to contribute, but most employers still decide to do so. But that cost would be only providing the employee $256 towards the cost that's nearly $2,000 for a family of 4. So I think it's important to keep the cost in mind. And so as you saw from Dawn's demonstration that of this enrollment portal, MHB is, actively trying to address and streamline the administrative burden on small employers by providing this user-friendly, efficient, one-stop shop system enrollment portal. And so we would like to see from this group what approach you think that you believe would be effective in reducing the premium costs for small businesses in this market. And a possible idea is, do we want to advocate for mandating employer contributions? How do we encourage employers to contribute more towards the employee and family coverage if that's the avenue we want to go in? But this group is put together for this purpose of addressing the issues in this marketplace, right? And everyone plays a role: the brokers, the carriers, employers, and TPAs, GAs, nonprofits, advocates, and we all have everyone from each of those groups in this call. And so are there specific policy changes or incentives that could help the rising premiums in the small group market? Are there regulatory or financial solutions that could help small businesses with the rising of the cost of premiums? So these are just discussion questions to lead that discussion, but I'd like to hear what everyone thinks.
Of particular interest are employers, because all of the other participants and partners here are part of a trade organization or have voices that speak for them. So while we want to hear from everybody, the emphasis would really be on those employers. But I see Eugene got his hand up, and I'd love to hear what he has to say.
Okay, so I see it falling into several categories in a small business. So marketing to small businesses, if you're dealing with a mom and pop shop and you're dealing with people that have what I would consider to be unstable cash flow, there's an issue in respect to how do we have those people realize that offering the program on the exchange where they can get up to 50% reimbursement of the cost structure, but right now it's set to do at the end of the year and only for the first 2 years. So as we have an individual market, they found a way to make that work so that the people getting their costs shared immediately on an individual basis. Is there a way that we can do the same thing for small businesses where they can get their costs helped or assisted immediately? That's one group. The second group are people who are federal, state, local contractors. And as you know, they have a reimbursement that they can get in their pricing structure where the government actually reimburses them. I think it's now $5 and something cents an hour per employee. So if they're under a government contract, those are people that I basically focused on because I knew that they were being reimbursed by the federal government through the Department of Labor and GSA to help pay for those benefits. So those are the ones that tend to pay for it all the time. But the big problem is all those people who are not federal contractors. But there's a credit, but no one's using it because they don't want to wait till the end of the year. They're trying to survive day to day. So that's the crux of what I see the problem is how do we have those people get more money as we have people who are getting federal contractors who get their money on a monthly basis. They actually build the government for it and get reimbursed for it. How do we fix that problem in that group? Of that group, that category of groups who are not federal contractors.
Well, if I can weigh in on that as well, Mimi and I and, Rick and all of us, Glenn, us brokers, and you, Eugene, we all see these costs, and it's like we know what the end result could be, and we know if we could somehow either funnel the individual, the amount that the individual would get on the individual exchange, funnel that through the business. Now, I understand, we've had a lot of conversation. We can't mix the markets. We know that, we understand that, but if we could find a way or have legislative sectors approve just to be able to funnel that amount of the tax credit that would pertain to that employee through the company, that would certainly alleviate a lot of the burden on the employer. So, and then say if they got a tax credit of, $200 and their premium is $300, then the employer could then step in and say, we'll compensate the rest or something like that. I mean, I feel like it's right there. If we could just touch it, if we could just touch the way that we could funnel that through.
Mm-hmm. Yeah, that is the crux of the issue.
Or just see if we can petition or request, that tax credit be raised and it can be used on an advanced basis versus at the end of the year. Because you're right, a lot of these businesses don't have it in the budget, and then you get to the end of the year and it's, only $1,000 credit.
Not too exciting.
Yeah, exactly. And I see Glenn wants to weigh in too.
Yeah, I agree with those points that were made. And I think the slide beforehand, even though it was hard for me to see on my phones because I'm taking my daughter to the airport. But at any rate, the point I was going to say was that it would be good if somehow, if a company want to have a group policy and still be able to take advantage of some of the, the tax credits, that could be applied in some form or fashion. But obviously, the federal tax credits are federal tax credits, and I don't know how that could be applied into the small group Maryland market, to relieve some of that cost. But it is a good idea. Like, I think that spreadsheet showed what cost would be if an employer, that they can, do the employees portion of a plan and then let them know that, obviously maybe the dependents can go into the Maryland, the individual marketplace, and how to toggle that back and forth would be an interesting way for brokers to be able to toggle into that somehow, and streamline that process. Like maybe some of the data that may have been entered in transfer over. I don't know. I'm thinking kind of outside the box without being an IT professional, but trying to think of a way to get that information to start to create an application potentially to be able to maybe help those people individually, and the broker that's already in with that, help them and maybe streamline the approach. Big picture, basically what I'm saying.
All right, thank you both for that. Anyone else, carriers, employers, any as well? Any input on this topic?
The only other thing I could think of as well is just to see if there can be an increased amount. I'm not sure what the formula is for the current tax credit, but it seems to be any group information that I've put in, I mean, it's just pennies. It's almost not even worth paying the accountant the extra 30 minutes to add it on the line item. So that may be an option as well, to really see if they can increase that amount that would match something like the individual market on an advanced basis.
Yeah, that tax credit it's a federal tax credit, and it's, that's something we can have looked into, but yeah, okay, I'm taking that note down as well. I did want to mention that if you recall, in 2022, we did the small group, the work group study for subsidizing small group plans, and that work group came back and said, and most of you were on that work group, Amber and Glenn and Rick as well, and it was that it would impact the individual subsidies by offering the small group subsidies. So I don't know if the initial idea that you both pointed out about funneling the APTCs to the small groups, if that would have a different result, seeing as to what the work group came back with, 2 years ago, as far as, not allowing subsidies to happen on the small group market. But it is still something that we can take back. Glenn?
I have one more comment. The state money, though, the pilot program for the young adults, that is state money. So that might be able to be funneled in to any dependents that are young adults, potentially. I don't know how complicated that would be, but that's kind of a thought, because it's state money that would either go to the individual person that's 19 to 37, or if they go to the small group. So anyway, I see that could potentially lower some of the cost.
Sure, definitely. I'm taking that down as well.
As long as they extend it, because that was a bill they got to extend that, because it sunsetted this year.
Also, Mimi, do you think that we might be able to see if a cost sharing reduction similar to the individual market might be an option as well? So that, if you're paying considerably more for the premium and then not to have that deductible, or have the deductible affordable based on your income, would that be possible to ask for?
Sure, wrote that down. The other item I was going to mention was what types of information would be helpful for this group, for us to continue this discussion. What do you guys think you would need to see as far as data or information that we could possibly try to get for you to have additional recommendations, or try to move forward with one of the ideas, or to look further into some of the ideas?
I think that these talking points are just the ones that keep coming up. I think that we've already looked at the amount of small businesses that are in the marketplace. We already know that the small group market is in danger. A lot of us already know. I mean, I can't think of any data that could be collected to help think of a solution. Does anyone else have a suggestion?
When I see a group that has 5 or less, or 10 or less, I've often gone in there and said, look, why not let the person go straight to the market, in the individual market? I'll be the broker for that. I'll take all your employees and get them done on the individual level, because it's the fastest way that I can solve the problem without the group getting itself into such complex finances that they put themselves at risk, as well as the employees. I had one group where the employee was coming from a governmental type of organization. And I said to them, look, that employee is used to how the government does things. If you as a small employer cannot consistently pay that premium, when you get a 35-40% increase the following year, that employee may come back on you and say, hey, you didn't tell me about this risk, I didn't know about that. I was going to lose my benefit the next year. Had I known that, I would have stayed with the federal government. I would have stayed with the state government job I had, So often I will just simply say, let's let them go to the marketplace and I'll help you get them in the marketplace. Because I know that when I look at the cash flow, I look at all these different things about the company, I know there's just no way in creation. If they get one slip on the banana, they're done. Financially speaking.
Yeah, that makes sense. All right. So what I'm gonna do is just let's keep this dialogue open about affordability. Like Amber said, we need to stabilize the marketplace and find some ideas as to how we could do that. One of the things I would like to add is that what would be easier for us to advocate for is like a certain regulation change, like mandating the contributions of an employer in the small group market, certain things that we could ask for legislatively to like, for example, in November we applied for like a uniform NPR regulation, and that went through, or things like that. We can make changes like that. We can request for things like that. But as far as like dollar amounts and like merging markets, that's a bigger discussion and that's a heavier lift. But I'm not saying one way or the other, but I'm just stating the facts that it's not going to be an easy pull, and it's not going to be something that we can promise to do. But I've taken down your notes, and if you have additional comments or anything else you'd like to send to me, you can email me directly. But I would like to move on to the next discussion item. I'll take a couple of comments if there are any about this before we move on.
I would only say that asking for a mandate, a percentage mandate for small businesses, I think that's a slippery slope. I just don't think these small employers can, afford to have to and be forced. I think that they would just not have the plans would be this has been addressed before. It didn't go well. And I think that's why a lot of employers just said, I'm not going to offer anything at all. So I think that we would need to consider that before, as a group, we would ask that there be mandates for a minimum contribution. I think that employers would just opt out.
Mm-hmm.
Go ahead.
My last comment would be, especially right now this year, with the fact that all these small employers with one W-2 employee has to start, they have to do the family medical leave insurance, and 15 and over employees are going to have to start putting away 0.45 and match the employee contribution for that. So these small employers are under a lot right now. So I kind of agree with her. It would be a slippery slope to put a requirement in for contribution.
Yeah, and then there's Maryland Saves. I agree with both of you. I feel like now would not even be the time to have that conversation.
I agree.
All right, understood. So moving on to ICRAs now then. As you all are aware, in the past we've had some folks come in and discuss ICRAs with us and educate us on ICRAs as they've become increasingly popular. And ICRAs, for those of you on the call who don't know what it stands for, it's Individual Coverage Health Reimbursement Arrangement. And what it is it's where it's an account-based health plan that reimburses employees for qualified medical expenses, such as monthly premiums, co-pays, and deductibles. And for the sake of this discussion today, we're just going to focus on the monthly premium reimbursement, because that's how we're using ICRAs to have a different program for small groups. And so how it works is that employers would set a monthly allowance, and the employees use that money to buy the coverage from the individual marketplace or on or off exchange, regardless of where they get it from. They just use that allowance from the employer to go on and buy an individual plan. With that, though, the caveat is that they don't get any additional subsidies from the government. There aren't any subsidies attached to that. It's strictly the employer's dollars, but it helps the employee access the cheaper or the less expensive rates on the individual marketplace. So that's the benefit of an ICHRA. And it's different from a traditional group plan in the way that the employer offers, well, in traditional group plans, employer offers the plans, they offer one or multiple plans, and they contribute towards that plan. They may or may not contribute, I should say, for each enrolled employee. And the employer typically pays for the plan at the end, the total amount that it costs for all enrolled employees, and deducts their employees' share from the payroll. And a few points to keep in mind about ICHRAs is that the employers choose how much they're willing to reimburse or what that employee allowance amount is. And there's no reimbursement maximum, and employees can take their plan anywhere. So even if that employee leaves the company, that individual plan stays with them regardless of how they're going to pay for it. And then a quick update on I think we've touched on Section 125 cafeteria plans. These Section 125 plans, they allow employers to offer benefits such as health insurance on a pre-tax basis to their employees. And this arrangement helps lower that taxable income for employees, and that helps reduce their tax liabilities. Employers also benefit from this system by decreasing their payroll taxes. And as more employers adopt ICHRAs, we would likely see an increase in number of employees purchasing the individual policies using their own pre-tax dollars. And so our primary goal, and I would preface all of this to say that an ICHRA program was discussed with leadership at MHBE, and we're sort of like at a wait and watch type of situation where we have certain circumstances, like employee circumstances and tax circumstances, that I will cover in the next few slides, that kind of led us to that decision, that led our leaders to that conclusion. But our primary goal was to work with an ICHRA administrator, one or more, and that would include the setup and management of those pre-tax employer and employee dollars, and adhere to all state and federal compliance requirements, including our system security, seamless integration with the HR and payroll systems, notices and communication guides on coverage and the offering, the employer's contribution and deadlines alongside the affordability calculation tool. And last but not least, the system that the vendor would provide would include a support hotline for users. And these are services that most ICHRA vendors are already providing on their own platform, but we just wanted to integrate that with our system. And so we have, we're aware of like over 60 or 40 ICHRA providers operating nationwide. And ideally, we would have liked to partner with at least like one or two, up to three providers from any of these ICHRA providers. So the considerations that I was talking about as far as the employee circumstance. So this chart sort of shows like where the enrollment would occur. So undocumented employees wouldn't have been able to enroll through Maryland Health Connection, but with this passing of the Access to Care Act, they will be able to enroll in plans on the exchange in 2026. And so at one point we had an X next to our on this chart, but now we have check marks next to both. So that's great news. That's one factor that we don't have to think about, or we don't have to worry about. And then the family enrollment for eligibility and employees, where the family is qualified for subsidies or Medicaid, they will be able to enroll in qualified health plans, and that would occur only through Maryland Health Connection because subsidies are not available through the ICHRA provider's own private exchange. And then the Medicare eligible non-retired employees could not enroll through either platforms because they would have to just buy their own Medicare plan. And we know there are Medicare eligible employees who work for small businesses today. So offering them the dollar amount is permissible, but they would use those ICHRA funds to pay for their Medicare plan. So that's how that would work, but their enrollment would not happen through either platforms. And the last one is out of area employees, which also occurs when there are, remote employees, but the employer is located in Maryland. We won't be able to service those on the individual exchange, but they would have to go ahead and purchase coverage through the ICHRA provider's private exchange, or they can go straight to the marketplace in the state that they live in. And then some tax considerations we have to look at are, so when we talked about Section 125 cafeteria plans, we have to also think about, so the first instance is the employer contribution on a pre-tax basis. That allowance could be taken by the employee and used to purchase the plan on the private exchange from the ICHRA private exchange or on Maryland Health Connection. But when there's pre-tax employee contribution, that dollar amount the employee sets aside would not be able to be, there's a prohibition allowing that to happen on the individual exchange. So that enrollment, the employee using their own pre-tax dollar, that enrollment would happen only through the private exchange. And then there is impact to APTCs where if folks, the affordable offer of coverage from the employer does impact the enrollment on the private exchange. That enrollment APTCs can only be used on the Maryland Health Connection website. So these are some of the considerations, but this is where I said earlier that we have to basically wait and observe the developments around what steps the current administration takes to either whether they ease up on how pre-tax dollars are used, the employee dollars are used, knowing that the current upward trend and ICHRAs are actually the current administration's previous tax regulations that allow this trend to even develop in the first place. So the goal is to meet the market demand for an ICHRA program for us, but we want to provide an alternative source for coverage for Marylanders and provide a high value program with low cost to MHBE. And ultimately reduce the uninsured population. So I do see a hand up before I go to the next slide.
Yes, Susan has her hand up.
Yep. Hey, good afternoon. Just looking at that, are we saying with these slides then, if the employees enroll through the exchange and they're eligible for subsidies, that they will have that reduced cost in terms of being in terms of the reimbursement for the ICHRA?
No.
Or they lose their subsidy? Because I didn't think you could have subsidy with the ICHRA.
That's correct. The ICHRAs do not work alongside the subsidies. That's right. But what I was getting at in that slide was that the families of those employees, so the employee only can use the ICRA funds, right? But if the family qualifies for the subsidies, the families can take advantage of those subsidies.
Okay, got
Yeah.
it. Thank you for clarifying that.
No problem. And so the other item we have to just really consider is our budget, that if we were to implement a program that would be affected by, some of the regulations, these tax regulations that prohibit the employees' own use of their own pre-tax dollars on the exchange, then, we don't want to make those types of investments where things can change at a later point. Um, and so just some of the options that were presented was a simple integration that would basically allow, so this is how our current new portal would look. And then there would be something on that same website that says establish an ICRA program through one of our approved vendors. And they would go ahead and click on the ICRA provider search, and a list of those ICRA providers would show up on there for them to research and see which provider they want to use. And we would set certain standards for those ICRA administrators, that they would have to meet certain criteria for us to be able to provide their services to our employers. And so the ICRA employer would be able to set up an account, set employee contributions, manage employees roster, payment of setup fees, compliance and reporting. In addition to the employee being able to also set up an account, use that provider's website, use the employer contribution, and shop, whether it's on Maryland Health Connection or the ICRA provider's private exchange. And then the employee at that point would be onboarded by the ICRA administrator and connect with an employee, with an authorized MHBE broker, and shop for plans on MHC for individuals or the ICRA providers exchange. They would then be required to upload their proof of coverage or waive their coverage. And then that ICRA provider would transmit 834 enrollment files and the 820 files back to the carriers. So this is the simplest form that we initially presented, and it would be minimal cost to MHBE, and it would be a simple integration ultimately. And then a moderate integration would look exactly like the simple integration, but what it would include is a custom link that the ICRA provider would provide to the employee, so that the employee can see what amount is reduced when they are plan shopping. So right now on Maryland Health Connection, if an employer provided an allowance, that employee would go on Maryland Health Connection or any other individual exchange, and they would not be able to see the contribution from the employer. So they're just plan shopping and then figuring out the amount that they would be reimbursed at a later point. But everything else would actually work exactly as I stated in the previous slide. The employee's experience would just be a little bit more enhanced, and that would be a little bit of a harder or a little bit more of an expensive pull for us to integrate that into our system. Now, this complex integration model would include a mirror exchange. So we've done a little research, and we saw that Colorado decided to establish a mirror exchange. What that looks like is basically the same individual exchange, but a mirror of it, and that would allow enrollment to occur as if they're enrolling off exchange to bypass the requirements that the employee could not use their own pre-tax dollars on the exchange. So that's one of the positive things about establishing the mirror exchange. But this is going to be an expensive integration. And again, we'd like to see what the current administration does as far as allowing that pre-tax dollar to be used on the exchange instead of us having to build that mirror exchange. And so this is just a summary of like these solutions, the basic, moderate, and complex models. And so just for your own, just for your feedback and consideration as far as what you think we should do as far as which integration you would prefer us to, which approach you would like, and which and how you think we should move forward.
Of course, I mean, and we all want to say the least trouble and expense, of course. I mean, but I think now in this stage of even the platform, I think now would be the best time to be able to add a mirror if we were allowed to funnel those APTCs through in the creation stage. I think it would be far less costly at this stage than later on, because then you're going to have to reinvent the whole wheel at that time. So that, of course, would be my suggestion.
Yeah, thank you, Amber.
Of course, I don't have the millions of dollars to fund it. But it seems like it would make most sense while you're in this creation phase to be able to do that.
Yeah, okay, Glenn and then Allison.
Know with the Maryland budget shortfall to be able to come up with the money to invest in a more enhanced one, I think would be kind of challenging at this stage. But I do agree, if you're gonna invest the money in it, you don't want to then build it, and then unless the vendor you use has the capability of enhancing along the way, and you stick with that vendor, where you start off with basic and then more enhanced and then advanced as time progresses, is how I would see it. And then it goes in stages, because let's face it, ICRAs, even for a broker, not written them, they're very complex, and a lot of detail and attention to detail into the weeds. And it's hard enough to try to sell a traditional policy, and now we're going to try to sell a traditional policy in small group with all these different plans, and then you're going to offer an ICRA. I just think that for a small employer, basic and simplicity is probably your best bet while it gets introduced, is just my opinion.
Yeah, I think, Glenn, you're right, but I still think despite all the other factors, and certainly the state budget challenges are a huge factor, if we're not at the table at least having this conversation, I can tell you there are thousands of other important initiatives, civic initiatives, that despite the fact that those budget challenges are overwhelming, interest groups are still going to have those conversations. And I really think that's a voice this SB PAC needs to express.
Granted, I understand your point.
Allison?
Hi, good afternoon, everyone. Allison Mongiorgino with Kaiser Permanente. I do agree, Mimi, that there's a lot to be determined as far as what kind of federal changes we can expect related to ICRA. So I think wise to kind of wait on this until we understand more. But when we do get to that point, the other thing I would like us all to consider is that the SHOP enrollment platform is a significant investment in resources and budget for the exchange, and we think it's wise and we want it to be a success. So I would want to ensure that the SHOP budget has enough funding for a marketing plan and advertising to promote that opportunity. And I wouldn't want that to be impacted by a significant investment in some kind of ICRA functionality. So just to keep that in mind as we think about the investment for this, I want to make sure that there are enough resources for that shop enrollment platform as well.
And if I can just add, I mean, just going back to basics, the ICRAs are still money that the employer has to put aside and invest. So it's not helping the employer reduce the cost for the employee or for themselves. So, I mean, I don't, although that it might be a good pathway for tax savings and a small incentive for the employees. However, I don't see that it is an affordability solution for the employers.
Right. And I think down the line, the idea was that down the line that, you know, if we had funding, that we would absorb the cost to set up the ICRA by using our platform. But that wasn't the initial launch idea. That would have been something down the line, but that would have been the part that would save the employer money.
Well, that's a horse of a different color then, sure. If we can,
right.
if we can secure funding.
Is not, yeah, that's the problem right now is the funding piece of it. But yeah. But yeah, and I do agree with Allison that our current focus should really be on shop or not shop, but the platform that we're building and making sure that the funding is there for that. And that's the additional piece of it, is that we don't want to take money off of one program to launch another program.
I don't know where I was on the day where I must have missed that day when we talked about it being funded for the employees.
That was just an internal discussion that down the line that we would do something like that, but it wasn't an initial launch idea.
Okay.
Yeah.
I thought I missed something.
No, you didn't. You guys are fine. So yeah, I think we're good to, we have about 10 more minutes. If there aren't any other comments or suggestions.
I would just like to say, you know, it always impresses me all the work that everyone who's contributing. It's just so good to know how much everyone has put into this, and just really truthfully wanted to thank everyone for all that you all do at the state level, and then all of us. You know, I think that all of our hearts are in the right place, and you know, certainly I think that if we can continue, we might be able to make a difference. And so I just wanted to really thank everyone for participating and contributing. It really means a lot.
That's great. Thank you, Amber. I don't see any other public comment, Mimi.
All right, then you guys get about 10 more minutes back in your day. Thank you, everyone. I appreciate you and my co-chairs. Everyone is, you guys are amazing. Thank you, everyone.
Thanks, everybody.
Thank you.
Thank you all.
Thank you.